Okay, can everybody see the PowerPoint?
There you go. Yes. Yes.
Okay, sounds good. We'll go ahead and get started. Okay, so today, my name is Michelle, and my partner here with me is Dan, and we are going to talk about the heart and the lungs. So when you think about the heart and the shape of the heart, you guys might be familiar with this picture on the left. It's something that you see a lot of on Valentine's Day and in pictures, but this is actually not what our heart looks like at all. So the heart actually looks more like this picture on the right side. So if we look into the anatomy of the heart is basically just a big muscle that's divided up into 4 chambers. So you can see there's 2 chambers above and 2 chambers below. This chamber here on the right side above is the right atrium. On the left side of the heart above is the left atrium. And then on the bottom half of the heart on the right side, you have the right ventricle, and then on the left side, you have the left ventricle. And the chambers of the heart are separated by these structures here called valves, and these are what help the blood flow in the proper direction throughout the heart. So they prevent the blood from going backwards in the heart, so they're pretty important. The one that separates the right atrium from the right ventricle is called the tricuspid valve, because you can kind of see that it has these 3 parts to it. So it's called the tricuspid valve. I want to pause for 1 second here. Okay, so we're just going to pause for 1 second so that you guys can work on your computer, and just let us know when you're ready.
Corey, it's Darcy. Hey, sorry, I had to call you. Oh, you are? Darn it. Okay. Well, I just plugged it back in. Okay, all right, thanks. Bye. Okay. Can you guys say something?
Okay, can you hear me? Is it working?
No, not yet, but our guy is here, so hopefully.
Okay, just let us know when you're ready.
Okay, we will. Sorry.
Okay.
When I turned the TVs on, these things were like fuzzy, like they were.
Where's my computer?
Here, this one.
Which one of you are hiding? Here we are. This one. Was this just recently upgraded to Windows 10? Your machine?
Oh, I got it then.
Okay. Oh, great.
Yeah, I don't.
One time we might need it.
I'm okay, guys. I'm fine.
And this is just through Zoom, right? Yep. How come you have 2 open? Just one second. It's kind of distracting, but I'm gonna go to YouTube and see real quick if it doesn't play through.
You might just listen to it every time in the other rooms go on.
Yeah. Zoom is a little funky a lot of the time. At least for us it is.
Yeah.
Mhm. But so are some people's HDMI ports too. But if it works in every other room, it shouldn't have any problem working here.
Anybody waits?
I'm sure. Did you hear that the two people couldn't go through the
Okay, so we have other people on the other side. Okay, so they can hear me. So, is there any audio coming from them yet?
Through the computer, we can hear the computer speakers.
Yeah. I mean, I just got it through the TV with YouTube, so now it's Zoom that's really causing me the issue.
Oh.
Yeah. So, like for YouTube, all your audio came through.
Should I disconnect from them and try again?
That's what I would do.
Can you guys hear me?
Yes, we can hear you.
We're gonna disconnect from you guys and reconnect and see if that does anything.
Okay.
Okay. All right.
So this is the kind of stuff we see with Zoom.
Really?
Yeah. Yeah, it's still playing through the computer. Could you just talk to us for just 1 second?
Yeah. Can
Yeah.
you hear me?
Okay, we're still getting it just through the. Let's you try one of those.
I wonder if I went to education, we could borrow a laptop.
How about now?
Okay. Can you hear me?
Yeah, I can, but we're getting a lot of interference because we're using two different cables.
You mean to see if education, I can borrow a laptop, try it?
You can. Does education have any like little computer speakers or anything we can hook up to your laptop?
I don't know.
I'll come with you and check.
It doesn't even get over it.
Okay, so I mean, it's so hard right now. Or no, I'm writing title. Wait, you don't pay, so it's 6. I don't know.
They want me to. Yeah, I saw you guys started pressing the other day. He's quitting. Yeah, Sundays is last night. Oh my gosh, why? I had no idea. I work there all the time. Yeah, everything. He was pretty slow.
You're not going to be.
I know. Pretty cool. It's so sad. Everyone's leaving. only go to Jeffers to see Preston.
People go there. Yeah, whenever people come in, it's really
Well, we've got.
we have 2 reads.
Every day.
That's what you guys are. How much did you guys get? I guess take on her off. I was just going like once a year. Yeah. So then I was like, I think I'll see you back. That's what I did. I got something. It was like
We have so many posts that.
Yeah.
peanut butter spreads. Probably like buttercup stuff.
I don't like it anymore.
I was like, it's like telling you, like, sooner or later, always goes to home. And Nikki's like, just she said one time that she tried to say she was stressed. People were like, a lot of people work there. Would you rather have a oh my gosh, I mean, my current Spanish teacher, it's so easy to get life from yours. Yeah. She was like, I learned a lot of Spanish, but she was also just the worst. She just hates everyone. Last year we literally learned how much sleep just like as a household. Like she just guilt tripped us the entire time. She was like, "This is your fault." And like it was like 283 years old. I remember all the upperclassmen told us to do was like, ask how you pronounce Malik or what's that freaking the only day, like, ask how you pronounce it. She goes off on like a 10-minute tangent every time. I don't know, I didn't ask. It wasn't stupid. It was something like Max Robertson told me. No, literally I had to give like 30 seconds. This year we had to do like it was like 40 seconds. I mean, it's like stuff we've never made. I'm gonna just test prep. Plus, we can if we do everything. We have on the side. We get like 20 points of extra credit. Might do that. So like, what we can do is and be like, this is what we need to review, and that way we know. He knows what he's doing. He just doesn't. He's literally said it's also like not even like really like they don't even know what they're doing. Like it doesn't. They gave us a book and what we're learning like on like Canvas or whatever. It doesn't even correlate with it's so seriously. Exactly. Yeah, and it's like exactly like biology. You know, where like we study something. It's just science. Yeah. Because like the rest of the we talked yeah, he's just big headed or something like that. Huh? Yeah.
Really not liking that.
This will be a second. Where is it going? Long back in the company. She's 50 years old. I mean, like, the blinker's on the left side. So, will you be able to after you get sleep out?
Wait a second.
I really would have rather had the 2 days off this week than like Monday's literally like 15 minutes. We still have highlights out there. Oh, I gotta be done. No, are they doing this like 2 week or this like Monday schedule thing next year? Next year? I don't like it. Like, I like the Monday off, but I hate it wouldn't be as bad as
You guys still hear me okay?
Yes, we can hear you.
Are you not gonna take? Yeah, that's what I want to transfer into. What hours? It wouldn't matter. I'm just not. Well, you have to. I mean, if you go to the honors one. Well, yeah, but you have to get into that. It has to be like you have to have one. What I want to say is since this semester technically counts as 104, like that counts as your entire credit.
Okay, could you just talk for me for just 2 seconds here?
Yes, can you hear me?
Yes, I can.
I wanted to take it.
One more time, can you talk for me?
Okay, testing.
Okay, all right, that's all I need.
Okay.
They're going to be able to hear you from this point on.
Awesome.
So I'll just let you guys go ahead and continue, okay?
Okay, we can't see you anymore. I don't know if that's an issue or not, but
Start the video.
okay, there we go. Perfect.
Good?
Yeah, is this volume okay the way I'm talking right now?
Yes.
Okay, perfect. So we will go ahead and get started again. Okay. Okay, so we were talking about the valves that separate the chambers of the heart. So between the right ventricle and the right atrium, or the atrium on top and the ventricle on the bottom, is the tricuspid valve, because it has 3 pieces to it. And then over here on the left side, between the left atrium and the left ventricle, we have the mitral valve, which is also called the bicuspid valve because it has 2 pieces to it, like you can see here. And then between the right ventricle and the pulmonary trunk is going to be the pulmonic valve or the pulmonary valve. This is a semilunar valve because the parts of it make these half moon shapes. And then you can't see it in this picture, but between the left ventricle and the aorta is going to be the aortic valve. And it's just like the pulmonic valve in that it's a semilunar valve as well. Okay, so if we just talk about the function of the heart is basically, it's a muscle, like I said before, and it contracts to pump blood throughout the body. So the heart will push the blood out into the body, and that's important because the blood carries oxygen to the tissues, and that's what they need to survive and to function. So the heart pumps out the oxygenated blood to the tissues through the arteries. So the arteries take blood away from the heart, and then after the blood has gone through the tissues and the oxygen has been transferred from the blood to the tissues, it comes back to the heart through the veins. So the veins bring the blood back towards the heart. And the veins are going to carry deoxygenated blood because it has already dropped off all of its oxygen to the tissues. And once the blood has gone through the tissues, it's also going to pick up carbon dioxide from the tissues, which is the waste material from the tissues. So if we talk about the heartbeat, there's this little portion of the heart called the SA node, and it's basically the pacemaker of the heart. So it acts all by itself, and it sends an electrical signal through to the rest of the heart, and to this AV node here, which is going to propagate that signal through to the rest of the heart and tell it to contract. So basically the heart uses electricity that goes through, and that's how it contracts all on its own to pump the blood without us having to think about it. Because if you think about it, we don't really have to tell our heart every time that we want it to beat, right? It just does it on its own. So this is done by these electrical signals starting at the SA node, going to the AV node, and that go throughout the rest of the heart, telling it to contract. And when the heart is contracting, that's what we call systole. And then when the heart is relaxing, that's what we call diastole. So when it's contracting, it's pushing the blood out of the heart, and when it's relaxing, the heart is filling back up with blood from the tissues. And in terms of the heart rate, our heart rate changes based on what we're doing. So if we're exercising, for example, the heart rate is really going to increase because our tissues, like our muscles, need a lot more energy to be able to carry out the exercise. So the heart is going to pump harder to push blood out to the tissues faster and kind of speed up the whole circulatory system to get that oxygen out to the tissues so that they can work harder. And then when we're resting, the heart rate goes back down, back to a normal resting rate because the tissues aren't working as hard, so they don't need as much oxygen. And if we talk about heart sounds, the heart sounds are created by basically the valves, when they close, that's what makes the heart sounds. So like the typical lub-dub sound that you think of when you think of a heartbeat. Or like if you guys have ever listened to a heartbeat through a stethoscope, and it makes kind of that lub-dub sound. Those are the sounds of the ventricles closing. They kind of snap shut, and that's what makes that sound. So the lub portion of the heart sound is the bicuspid or the mitral valve closing, and the dub sound is the aortic valve closing. And then if there's a problem with the heart valves, so like let's say maybe one of them doesn't close all the way, then we're going to hear an abnormal heart sound called a murmur. And these kind of sound like a whoosh sound in the heart on top of the regular heartbeats that you would hear. So I have some examples for you guys to listen to. First, we'll start off with a normal heart sound. Maybe. Hang on just a second here. Okay, could you guys hear those heart sounds at all?
Yes.
Okay, perfect. So that was the normal heart sound. And if we go to an example of a murmur, this is an example of aortic stenosis. So you can kind of hear how that one has like a whooshing sound on top of the regular heartbeat. So that's what a murmur sounds like. Okay, so now if we talk about blood flow through the heart, we're going to look at it on the two sides of the heart. So we'll look at the right side of the heart first. So on the right side of the heart, we have the right atrium and the right ventricle, like we talked about before. And we have these big vessels that connect to the right side of to the right atrium. This one here from above is the superior vena cava, and the one from below is the inferior vena cava. So these vessels are going to bring back the deoxygenated blood from the tissues back into the heart, and it comes right in here to the right atrium. So then from the right atrium, it's going to go through, and I guess I should tell you that the superior vena cava drains blood from the head, neck, and upper extremities, and then the inferior vena cava brings blood from the rest of the body into the right atrium. And then from the right atrium, it's going to go through this tricuspid valve into the right ventricle, and then from the right ventricle, it's going to go through the pulmonary valve into the pulmonary trunk and to the pulmonary arteries. So the pulmonary arteries are going to take blood away from the heart, and it's still deoxygenated blood because it hasn't been to the lungs yet. So it's going to take this blood to the lungs, and then when we breathe in the oxygen is going to get transferred from the air that we breathe in to the blood. And then from the lungs, once it's been oxygenated after we breathe, it's going to come back to the heart through these pulmonary veins. So this is going to be the oxygenated blood, and that's going to come into the left atrium. So we're going to have pulmonary veins on both sides from both lungs, the right lungs and the left lungs, and they're all going to connect into this left atrium, and they're bringing the oxygenated blood back into the heart. So from the left atrium, it's here, I'll advance the slide. From the left atrium, the oxygenated blood is going to go through the mitral valve into the left ventricle, and then from the left ventricle, the heart's going to push the blood out through the aortic valve and into the aorta, where it's going to go out to all the tissues of the rest of the body. And that's how our tissues are going to receive their oxygenated blood and get the oxygen that they need to function. So this is kind of just a big picture of the circulatory system that we just went over. So here we have the superior vena cava and the inferior vena cava that bring the blood to the right atrium of the heart, goes through the tricuspid valve into the right ventricle, through the pulmonary valve into the pulmonary trunk, and then through the pulmonary arteries into the lungs, where it gets oxygenated, so it turns from blue to red, and then the oxygenated blood is going to come back into the left atrium and through the mitral valve into the left ventricle, and then it's going to get pushed out of the heart through the aortic valve, through the aorta, and then to the rest of the body, to the tissues in the legs, the abdomen, and the head, neck, and upper extremities. Okay, so this is how the whole rest of our body gets blood, but the heart also needs blood to function as well. So like we said, it's a muscle, just like the rest of our tissues, and the muscles of the heart also need oxygen to be able to make the heart work. So the heart has its own blood supply through arteries that are going to bring blood to the muscles, and then it's going to be drained with veins that go back into the heart, just like the rest of the body as well. So the arteries are red, and they're going to fill during diastole, which is when the heart is relaxing. And then the veins are going to carry the deoxygenated blood from the tissue of the heart back into the right atrium of the heart. This is like a posterior view of the heart. And in this big vein here, it collects all of the blood from the heart and puts it right back into the right atrium, which is right here. And then just one big vessel that I wanted to point out on the heart is this artery here called the left anterior descending artery. And this is the artery that is most commonly affected in a heart attack. So if we talk about a heart attack, this happens when the coronary arteries, so those ones we just talked about that supply the heart, when they get blocked by whatever it is, whether it's a thrombus or if it's a plaque like atherosclerosis, that blocks off this artery, so not as much blood can get through, and then our heart doesn't get the blood supply or the oxygen that it needs to be able to function properly and pump blood out to the rest of the body. So let's say we have a blockage right here in this area of the left anterior descending, then everything past this blockage in the heart, so all of this tissue in this area of the heart that's being supplied by the left anterior descending is not going to get the proper blood supply because it's just blocked off right here by whatever is inside the vessel that's blocking it off. So none of this tissue is going to function properly, and therefore the heart is not going to function properly. So this leads to another issue in the heart called an arrhythmia, which is basically an irregularity of the heartbeat because the electrical signal can't get through to all the tissue of the heart, so it can't contract normally. So some symptoms that people feel when they're having a heart attack, they might say that they have this type of crushing chest pain, or it feels like an elephant is standing on their chest. It's sometimes also described as a tight chest pain where somebody like wrapped a belt around their chest and just tightened it up. And they might also have pain. So they can have chest pain, but they can also have pain in their back and in their neck. And some of you might have heard like into the arm or into the jaw and shoulder. And this is just because different nerves that go to different places in the body share some of the same pathways once they get closer. So even though you're having a problem in your heart, it might feel like you're having pain in your arm. And then some of the other common symptoms are dyspnea, which means shortness of breath. Syncope is a fancy word for fainting. And then just feeling sick to your stomach, like nausea and vomiting. Might feel weak. And diaphoresis just means that they're feeling sweaty. And they might have like an increased heartbeat. So these are some of the for in a heart attack. Okay, so now we're going to move on to the respiratory system and take a look at the lungs. So here you can see this structure, which is the trachea. That's where the air comes in when we breathe, and it splits off into these main bronchi that go to each of the lungs. So this is the left lung, this is the right lung, and these are going to keep branching into these really small structures in the lung where the oxygen is going to go in and be exchanged and transferred over into the blood, and where the carbon dioxide from the blood is going to come out and then be expelled when we breathe out. And then if you can see here, this little spot on the left lung looks different than the right lung, and that's because that's where our heart sits. So that's the cardiac notch of the left lung. Okay, so if we look at the anatomy of the airway, the air is going to come through the nose when you breathe into the nasal cavity, and it's going to go down into the pharynx and larynx, which is like your throat area, and then it's going to go into the trachea and split into, when the trachea splits, it's going to follow this into the lungs where it's going to be oxygenated. And if we look up here at this structure right here, that's called the epiglottis. So the epiglottis is special because when we're eating, we need to make sure that our food goes into our esophagus, which is just behind the trachea here, because we don't want our food to go into our trachea. I'm sure you guys have all know what it feels like to choke on your food or have your food go down the wrong pipe. So sometimes the food can go down into the trachea and it makes us cough, because we do not want food to go down into the trachea and get into our lungs. So the epiglottis is going to, when we swallow, it folds down and it basically covers this opening into the trachea to block food from going into the trachea instead of the esophagus where it belongs. Okay. So if we look at the lungs, the right lung here, you can see that it has these divisions, these lines that go across, and it divides the lung into different lobes. So this one on the top is the superior lobe, the one in the middle is going to be the middle lobe, and then the one on the bottom, and it actually goes all the way up the back of the lung, is called the posterior or the inferior lobe. And then on the left side, there's only two lobes, the superior and the inferior lobe. Okay, so if we follow the trachea where it splits into the bronchi and it keeps splitting, splitting, it's going to go all the way down to these little tiny structures called alveoli. And this is where the actual gas exchange happens, from where the oxygen from the air gets transferred into the blood and the carbon dioxide from the blood gets transferred into the lungs to be breathed out with the air that we are breathing out. So you can see all of these vessels that come all the way down and interface with these alveoli, and that's how the blood gets really close to the air that we breathe so that this gas exchange can happen. Okay, and then just to describe how we breathe, this involves different muscles and our thoracic cage, so that we can expand our lungs and let the air in. So if we look at this muscle right here, this is called the diaphragm, and it separates the thoracic cavity from the abdominal cavity. And when we breathe in, the diaphragm is going to go downwards, and it's going to basically pull these lungs down and make the thoracic cavity bigger so that the lungs can expand and fill with air. We also have these muscles between the ribs called the intercostal muscles that are going to help pull the ribs outwards so that the thorax can expand and the lungs can expand inside of the thorax. And that's when we take a breath in. And then when we breathe out, the opposite happens, where the ribs are going to come closer together and make the thorax smaller. The diaphragm is going to go up and it's going to squeeze the lungs so that the air can come out and be expelled. Okay, so this is just another picture of the gas exchange in the alveoli. So we have the vessels that bring the blood to the alveoli. So it's going to bring the deoxygenated blood, where the carbon dioxide is going to come out of the blood and go into the air. So this is our alveolus, and this is the vessel that's surrounding it. So it's going to bring the deoxygenated blood. The carbon dioxide is going to come out of the blood and into the air. And then the oxygen is going to come from the air and go into the blood. And from there, it's going to travel through the blood into the rest of the body and get transferred to the tissues. Okay, and then when we have a problem with our lungs, sometimes we can have problems like, you might have heard of like pneumonia or asthma, those types of things. When people have problems with their lungs, it can create these extra lung sounds. So instead of the regular breath sounds that you guys are used to hearing, there's going to be some added sounds that are telling you that something isn't right within the lungs. So we'll go listen to some lung sounds. Okay, so first we'll listen to the normal lung sounds. Okay, so that's what a normal lung sounds like, just regular breathing, which I'm sure you guys are all familiar with. And then we have an example of crackles. Crackles, if we go back to the slide for a second, so crackles basically sound like a snap, crackle, and pop. Like if you guys have ever had like Rice Krispie cereal, when you put it in with the milk and it makes that crackling and popping sound, that's basically what crackles are going to sound like. So if we go back to the sounds, we can listen to some crackles. Okay, so you can see how that kind of sounds like the Rice Krispie cereal that when you mix it with milk and it makes that kind of crackling sound. So this can happen in a number of different problems like bronchitis, pneumonia, heart failure, that kind of thing. There's also wheezes that sound kind of like a whistling sound, and these happen in like asthma or some type of airway obstruction. And then we also have rhonchi, which basically kind of sound like a snore while you're breathing. And this is when there's secretions in the large airways. So there's a lot of problems that can cause that. And that's what that sounds like. So if we look at a chest x-ray and an example of pneumonia, pneumonia is when you get an infection in your lung, and basically the bacteria gets inside of your lung and your lung tries to fight that off by producing a lot of extra secretions, and it kind of fills the lung tissue with these secretions. So on the left side here, you can see a normal chest x-ray. In the middle and to the left side, you have the heart here. This darker area is going to be where the lungs are. They're filled with air, which are dark on an x-ray. And then you can see the ribs here that kind of go around. You're seeing the front and the back of the ribs, so that's why it looks like they kind of arc around like that. So the lungs should look mostly black when they're filled with air like this. And then if we look on the right side, you can see this consolidation or this brightness in the right middle lobe, and that's because there's a pneumonia there. There's an infection in that lobe of that lung, and it's producing extra secretions, and this is how it looks on a chest x-ray. So another problem that we can have in the lungs is called a pulmonary embolism, and this is similar to a heart attack where there's a blood clot in the lungs that's blocking the blood from getting to the lungs. So basically there's an area of the lung that can't get the blood, so no gas exchange can happen in those areas. So like if you look at the one on the left here, if you have a pulmonary embolism in the main pulmonary artery, then there's going to be no blood that's going to go to this whole entire right lung. So there's going to be no blood that's going to be oxygenated like it normally would in this right lung and be able to go back to the rest of the tissues. If you look on the one on the right side, these are an example of smaller pulmonary emboli. So there's one right here and one right here, and you can see past those smaller ones is going to be the areas of the lung that are not going to get the blood's not going to get there, and it's not going to get the oxygen that it needs to go back. So a lot of people feel very short of breath if they have a pulmonary embolism. Okay, so this is the end of the lecture, and so we will move on to the dissection now. We'll give you guys a couple minutes to get ready to do that. Okay, is everybody ready to start the dissection?
We're not quite ready yet.
Okay, let us know when you guys are ready.
Just break the stern. That's on this week. Oh. Perform CPR. 2 inches of pressure. It's not hard. 30 and like 2 breaths.
Yeah, but you can do it in like a 20 seconds.
It's to the beat of staying alive. Ooh.
Yeah, but it's a field. You gotta get snows in there. I just suck me into this. The CPR say you gotta get the nose to.
Gotta hold it like this. Oh.
I think we do.
Just, I was thinking about that. Basically, just put half the baby's face in them.
Yeah, that's exactly what you do. She's a full face mask. And I was like, what? He goes, make sure your mouth covers your nose and mouth.
Imagine if like the baby's crying.
Yeah, that's what I was just about to say.
Okay, we're ready.
Okay, we will go ahead and get started. Okay, so the first step that we're going to do is we're going to make an incision in the midline, basically from the throat all the way down to the stomach area. Just make sure that you're below the rib cage here. And you can go pretty deep with this incision because, not so much in the neck, but like in the chest area, because you're just going to go down to the bone, which is what you want in this case. So you make your incision in the midline, and then you can kind of just separate the tissues. So what we're cutting through is skin first, then we have dermis, hypodermis. We're going to cut through the pectoralis muscles. So if anybody likes to work out and do like bench press, that's going to use your pectoralis muscles. So we're going to cut through those, and we're going to get down to the bones, which the one in the middle is going to be the sternum, and that's where our ribs are going to connect, except for the 11th and the 12th ribs, which are floating ribs. Okay, well, hang on one second. We'll get the computer fixed here. Okay, is that better?
Yes.
Okay.
Yeah. Thank you.
Okay, so if you guys just want to pull your skin away from the chest wall and open it up on both sides. So what we're going to do next, you can probably feel the sternum under here. What we're going to do is use our scissors, go underneath the sternum, and cut through the bone to open up the thoracic cavity. So you'll want to be a little bit careful with this because the heart is going to be right underneath there. So just make sure that you're right underneath the bone, and you might have done this with your scalpel like I kind of did. You can see that mine is separating here already. So you just use your scissors to cut up the middle of the bones all the way up and open up the thoracic cavity. And then you can kind of use your fingers to separate everything and go back with your scissors if you need to cut some more. But we just want to open it up so that we can see the heart and the lungs. And you'll also find that there's probably a lot of fluid in here, so you might need to use some paper towels to sop up the fluid that's in there. So you'll kind of want to just separate everything so that you can really open it up and get a good look at what's going on inside. We'll give you guys a minute to get your thoracic cavities opened up.
I think we can respect each other. This is other one.
Okay, so we'll move on to the next steps. And at this point, we're just going to try and identify a few things, and then we'll keep going with the dissection. So if you open up your thoracic cavity here, you should be able to see the heart that's right in the midline. And it's going to be covered by this connective tissue covering here, which might have been cut when you made the cut for your thoracic cavity through the bones, which is fine. But this is called the pericardium, and it just surrounds the heart there. And sometimes this connective tissue membrane around the heart can get inflamed, and that can cause some problems. There's a bunch of different things that can cause that, and that's called pericarditis. That's when the pericardium gets inflamed. And then if we look on either side, you can see the left lung and the right lung. And in pigs, they have one extra lobe on each lung than humans. So on the right side, instead of having 3 lobes, they're going to have 4 lobes. So the lowest lobe here, the most inferior lobe, is the diaphragmatic lobe. The one in the middle is going to be the cardiac lobe. The one on the top is going to be the apical lobe. And then there's one that's kind of behind the heart here, and that's going to be the intermediate lobe. And then on the left side, we have 3 lobes, and they're just going to be the diaphragmatic, the cardiac, and the apical lobes. So if we look here below the heart, you can see this muscle that kind of arcs around, and this is called the diaphragm. This is the muscle that helps us breathe, and it separates the thoracic cavity on top from the abdominal cavity below. And then some of you guys might see this fatty kind of looking tissue here on top of the heart. This is going to be the thymus, which is a gland that is used in, or I'm sorry, it's involved in the production of T cells, which are part of the immune system. So this is the thymus here, and we're going to remove that so we can get a better look at the heart. So the next steps that we'll take are going to be to cut the diaphragm on either side so that we can free up the thoracic cavity even more. So if you take your scissors or whatever you're going to use and just cut the diaphragm down the side, and you'll do this on both sides of the diaphragm. And if your pericardium wasn't cut, you'll open up the pericardium and remove it as best as you can, and you can also remove the thymus here as well. So like I said, there's going to be a lot of fluid in here, so feel free to use your paper towels as you need to kind of mop that fluid up. So you can kind of just use your fingers to tear out your pericardium. And if you can't quite get to the back of the heart right now, that's okay. We'll be removing the heart, so we'll get there. Okay, so now that we have our pericardium open and our thymus removed, you can get a better view of the heart. And so we will try to identify different parts of the heart here. And I'm just going to move my lungs out of the way. Okay, so you can see these two parts of the heart that are on top. I hope you guys can see that. Yeah, maybe we'll lower the camera so you guys can see it a little bit better. But while Dan's doing that, I'll talk about the different parts of the heart. So the two portions on top, this one right here is going to be the right atrium. This one is the left atrium. And then down on the bottom, we're going to have the right ventricle here, and then the left ventricle over here. If you guys look at this vessel that goes kind of diagonally down the middle of the front part of the heart, it might be just underneath some connective tissue there. But there's a vessel that goes down here diagonally, and that's that left anterior descending vessel that I had mentioned before. They call this the widowmaker because a lot of people die from heart attacks from blockages in the left anterior descending artery that's supplying the heart with the oxygenated blood that it needs to be able to contract. Okay, so what we're going to do now is try to look at the great vessels that connect into the heart and bring blood to the heart and also take blood away from the heart to the rest of the body. Okay, hopefully you guys can see this a little bit better. So what we're going to do now is the vessels that we're going to look at are going to be superior to the heart in this area. So you guys are just going to want to open this up here and cut through any bones and tissue that you have on top of the great vessels here. So what we're looking for, you can kind of see this big one here on mine, this big blue vessel right here, that's going to be the superior vena cava. So this is what connects into the right atrium of the heart, and it's what's draining the head, the neck, and the upper extremities. It's bringing that deoxygenated blood from the tissues back to the right atrium of the heart. So if you can uncover this vessel, so just take off everything that's on top of it, uncover this vessel, and we can use this vessel to find the other ones. You might already see some other smaller vessels coming off to the side here, so be careful with those as you remove the tissues that are on top, and just try to uncover those as best as you can. These are what we're looking for. So I'm just using my probe to kind of chip away at this tissue here that's covering the great vessels. And we're going to take away all the tissue until we get to the trachea. So you should be able to see the trachea going in the midline. That's where the air comes in to get to the lungs. And it has these cartilaginous rings. So you'll be able to see these kind of white rings that go along the tube that is the trachea that's in the middle here. So once you get to the trachea, that's where you're trying to go. That's what you're trying to find. Okay, so if you guys are still working, that's okay. You guys can keep on working, and I'm just going to use what I have here to talk about some of the great vessels that we have uncovered in this area. But if you guys need to keep working, that's okay too. So we're going to start again at the superior vena cava, which goes into the right atrium of the heart. So if we follow that up, it's going to give off the brachiocephalic veins. And I guess I should also say that the vasculature in the pig is different from the human, but I'm going to use the human model to explain what goes on, because the pig is a little more complicated. So we're going to have the subclavian that gives off, or I'm sorry, the superior vena cava that gives off the brachiocephalic veins. If we follow those out, you can see these veins that go straight upwards in the neck on both sides. So we have one right here and one right here. These are the internal jugular veins. And if we keep going out to the side, you're going to have the subclavian veins that go out from there. So in general, the veins are all going to be on top of all of the arteries. So if you look a little bit beneath, you can see the red structures or pink structures like this one here. So just underneath the internal jugular vein that's going up into the neck, or I guess coming down from the neck, we're going to have the common carotid arteries that go up into the neck. So these are going to take blood from the heart, the oxygenated blood from the heart, up to the structures of the head and neck. So these are our common carotid arteries, and further up, they branch even farther into our internal and external carotids. And if we go behind the superior vena cava, that's where you're going to find the aorta. It's going to be a big vessel behind the superior vena cava. And if you can't really see it right now, that's okay, because once we cut out the heart, you should be able to see it better. But the aorta is going to come out of the left atrium of the heart to take that oxygenated blood up and out of the heart to the other structures of the body. And on the right side, it's going to give off the brachiocephalic trunk, which is where the common carotid comes off of, and the subclavian as well. And then on the left side, the common carotid comes directly off of the arch of the aorta, as does the subclavian artery. So then, if you guys move down a little bit and pull your lungs to the side, you should be able to see the vessels that connect the heart to the lungs. You might have to use your paper towels and kind of mop up some of that fluid. Okay, so right here, you can see some of these blue vessels that are taking the deoxygenated blood. So these are your pulmonary arteries. They're taking the deoxygenated blood from the heart to the lungs to be oxygenated in the lungs. And then once the blood gets oxygenated in the lungs, it comes back through these red vessels that are behind the pulmonary arteries. These red ones are the pulmonary veins, and those are bringing the oxygenated blood from the lungs back into the heart, and they connect to the left atrium there. So what we're going to do now is cut the heart out of the chest so that we can see the rest of the vessels in the back there. And you should be able to, if you actually kind of just pull the heart upwards and maybe over to one side, coming up from below, you should be able to identify the inferior vena cava which is the great vessel that's bringing the deoxygenated blood from the tissues of the rest of the lower body back into the right atrium of the heart. So what we want to do is, once you identify the inferior vena cava, you're going to use your scissors to just cut that vessel and free up the heart. So I've got mine uncovered here. And I'm just going to put my probe underneath it and take my scissors and cut that vessel. To free up the heart. And then we're going to go up to the top of the heart and cut the superior vena cava. And try not to go too deep with that cut because the aorta is going to be right underneath it, and we want to take a look at that before we fully cut the heart out, if we can. If you can't, that's fine too, because you'll see it once you take the heart out. So you might have some pericardium that you need to remove from the posterior side of the heart, so you can use your probe or whatever works best to kind of remove that. You can look at the inferior vena cava, the the superior vena cava going into the right atrium, and then just behind there you should be able to see the aorta, which mine is still a little bit covered up here, but see if I can uncover it a little bit. Okay, so here you can see the aorta. So we will cut this as well, and then we'll also cut any of the vessels that are connecting the heart to the lungs so that we can pull the heart right out of the thoracic cavity. Okay, so now we'll move on to looking at the heart. So we'll just identify some features of the heart real quick. Okay, so this is how the heart was in the chest of the pig. And on the right side on top, you have the right atrium. That's this chamber of the heart here. You can kind of flap it around a little bit. On the left superior aspect of the heart, you have the left atrium. And then down here, you have the right ventricle. Here you have the left ventricle. And this is that left anterior descending artery. You can kind of tease it out if you want to get a better look at that. I kind of tried to tease mine out a little bit so we could see it, but I have my probe underneath here. This is the left anterior descending artery. And then coming from the right ventricle, you can see this vessel here. This is going to be the pulmonary trunk. It's what takes the deoxygenated blood from the right ventricle of the heart into the lungs through the pulmonary arteries. And then if we kind of turn the heart to the back side, you can see this blue vessel coming into the right atrium here. This is the superior vena cava. The large blue vessel coming into the bottom part of the right atrium is the inferior vena cava. And then you can see all of these red and blue vessels back here that are connecting from the heart. These are going to be the pulmonary arteries and veins that are connecting the heart to the lungs to get blood to and from the heart and the lungs. And then this large red vessel here is going to be the aorta. That comes from the left ventricle, and it takes the oxygenated blood from the heart to the rest of the tissues. So what we're going to do now is cut the heart open. So we're just going to cut right across the heart about 2/3 of the way down from the top. So right about in this area, you're just going to cut right across the heart with your scissors to open it up and be able to look inside the ventricles. So you should be able to take your scissors and just make a cut across the bottom of the heart here. And then we're going to look inside. You should see this kind of waxy material inside of the heart, and you can just use whatever you need to, any tools, or if you can just rip it out with your fingers to just remove this so we can look inside. So on the left side of your heart, you should have red waxy material. That's because the blood on the left side of the heart is oxygenated. And on the right side of your heart, you should have blue waxy material for the deoxygenated blood. Except that mine looks like both sides have red material. So we'll see what we can find in here. Or it didn't look like, it doesn't actually look like anything got into the right side of the heart on mine. But one thing that we want to notice within the walls of the heart is a major difference between the left side and the right side. So on the right side of the heart, the wall, the muscular wall, is going to be a lot thinner than on the left side of the heart. That's because the left side of the heart has to work really hard to pump all the blood out to the whole rest of our body, whereas the right side of the heart is receiving the blood from the body and it just has to pump it to the lungs. So it has a lot less strenuous of a job to do than the left side of the heart. So the muscle and the wall of the left side is going to be a lot thicker than the muscle on the right side of the heart. And what we're going to do next is you guys can make like a longitudinal cut up the heart to see better inside the ventricles and the atria, and try to take a look at the valves as well. So I'm just going to remove any other waxy material that I find inside the heart here. Okay, so it might be kind of hard to make out, but what you should see on the left side of the heart is going to be the mitral or the bicuspid valve. And if you can get all the material removed from the right side, you'll see the tricuspid valve. So this is my left side where I'll have the mitral valve. And I'm going to cut down the side of the right side of the heart so I can look in there and try to find the tricuspid valve. So you guys can kind of see a little piece of the valve right here. Let's see if I can get a better view of it. Okay, so this is going to be the tricuspid valve right here. Kind of hard to see since we've ripped out all that material, but it's just this right here. And that's what separates the right atrium from the right ventricle. Okay, so the last thing that you guys can do if you would like to is go back into the thoracic cavity of your pig and just look at the vessels that are left in the thoracic cavity there. So you should see the superior vena cava, inferior vena cava, the aorta, and then the vessels that connect the heart to the lungs and the lungs back to the heart. And once you guys are all done with that, you can go ahead and clean up your stations And if there are any questions, feel free to go ahead and ask. We'll unmute your video so you guys can ask questions if you have any. And then finally, when you guys are all done, you can go ahead and take your post test.
If you want to keep looking around, you can. Just don't dissect into the GI system. Don't worry. Don't worry. And hey, when you guys are done, take both your tourniquets and tie them up so the body cavity is tied up.
Yeah.
So everything's there.
We can fix it. We will rebuild. Start pumping CPR. Don't. Hey, hold up. I don't want him to just like shovel.
It's not that long. This thing, we were expecting 7 o'clock anyway, so it's okay. But yeah.
Okay, guys, if there's no other questions from you guys, we will sign off from here. And thank you very much for your attention, and we'll see you guys next time.
Thank you. If you guys on the inside want to bring your tray over and dump your juice in the bucket.
I'm not saying anything. That's okay.